Doctors are expecting the national bulk billing rate to drop as low as 30% over the next 2 years unless urgent funding is provided. Let's go to the AMA. We'll bring in the AMA now. Actually, good morning to you. So where is your assessment here at the moment? I mean, we've got some doctors that say it's going to be 30%. Other groups say it's upwards of 60%. So what is your assessment on where things are at the moment?
Look, there's all sorts of numbers being thrown around, but the bottom line is that for a long time, Medicare hasn't kept up with the cost of providing medical services. It used to, when Medicare first started in the 70s, it really did cover the cost of providing care, and now it covers less than 50% of the cost of a usual GP consult. So that's why we're seeing consultations get shorter or out-of-pocket costs grow, despite GPs doing everything we can to contain costs and make sure that our most vulnerable patients have access to a GP and that comprehensive care that we all deserve to have in a country like Australia.
So where is this heading within the next couple of years, if nothing is done?
We have some hope. We do think that the new health minister gets it and understands that general practice is the cornerstone of our healthcare system. There are things like the Strengthening Medicare Task Force that we hope over the next few months will start making some decisions to modernise Medicare and start filling those gaps that are making it harder to provide care to Australians. But it's just the beginning, and unfortunately, if not more is done, we will see higher out-of-pocket costs. We'll also see GPs turn away from the profession because the burden of trying to provide that comprehensive care with inadequate resourcing is just getting too much.
So do you think then people, won't be able to afford those gaps, those gap fees? They'll just end up clogging up emergency sections of hospitals?
Partly emergency, but also we just know that people have gotten sicker, more complex health problems, particularly over the past couple of years, where for very good reason people were nervous about entering the community and some people delayed their health care. We know that care has become more chronic, more complex. We know that Australians want more time with their GP so that they can have the complexity of their issues unpacked and dealt with in a longer consultation. So we're really calling on government, and we'll continue working with government to make sure that we reward those longer consultations, that complex care, and make sure that Australians get the time with their GP that they need.
How much is needed to fix everything?
It's always a good question. It's partly about money, but it's also about the structure and the way we operate general practices. So we are looking forward to helping develop some new ways of funding general practice that makes better use of the whole team we've got, so that we can use our nurses in general practice to the best of their abilities, so that we can use digital technologies when it helps us improve care, and so that we, as I said, make best use of those longer consultations so that when you've got time with your GP, it's the most effective use of time possible.
That's Dr. Danielle McMullen there, the Vice President of the AMA. Thank you very much for your time this morning.